Health Minister Shane Reti has told Newshub he has concerns for the health system that allowed a Canterbury woman to believe she had incurable cancer for 10 weeks after a mix-up at the pathology lab.
Since we brought you Angie Hawkins' story last night, we've been contacted by other patients who've gone through a similar cancer misdiagnosis. For more on this, we're joined by national correspondent Amanda Gillies. Kia ora, Amanda, what's the latest?
Kia ora, Mike. Well, first, just a reminder, Angie Hawkins was last year told she had incurable breast cancer, which had spread to her lungs and her lymph nodes. She, of course, planned her funeral. She brought in family from overseas. She gave away her belongings and she prepared to die. But then 10 weeks later, Mike, she was told she didn't have cancer, any type of cancer. There'd simply been a mix-up in the pathology lab. She'd been given someone else's results. She was devastated. And here's what a very unimpressed health minister told Newshub this afternoon.
I have concerns for the system that allowed this to happen, and I have expressed those concerns to Health New Zealand, who will or have undertaken a review and will look at system improvement. I've expressed my concerns as soon as I was made aware of it at the highest level, and this is very unfortunate. Things need to change.
We've got really robust processes set up to prevent this from happening, but occasionally, when you get tissue into a lab, it can look different, and I guess it's like any test, nothing's perfect, and that's why it's a rare occurrence to happen, that it's unusual.
So, Mike, that second interview was Chief Clinical Officer for Health New Zealand, Richard Sullivan. He spoke to us about an hour ago. But, Mike, in the past 24 hours, we've heard from several Kiwi patients who have told us of a similar cancer misdiagnosis. We spoke to one man from Tararua who said he was having bowel issues. He went and had a colonoscopy and was told to get his results from his GP. There was a visiting GP who said to him, "You have bowel cancer, you'll need your bowel removed and you'll end up with a bag. Get your family around and say goodbye." He was understandably devastated. He planned for his funeral, he took time off work and he had those reunions with his family. When he went to his next hospital appointment, that was nearly 3 months later, he was prepared to get his bowel out, and then the nurse there said, "No sir, this is just a follow-up. Your polyps are benign, there's nothing wrong with you." They couldn't believe it. They were gobsmacked. They went back to that GP's offices. They were offered no apology, no counselling. They were simply told, "Oh, it was a breakdown in communication." But I can tell you, Mike, that the Health Minister does not want this happening again.
Thanks for that update, Amanda. Te makwe.